Welcome back. Doctors recommend nearly everyone over the age of 6 months get the flu vaccine every year. And here to talk more about this year's vaccine and especially treating our children is Dr. Lyn Ranta. She's been on the show plenty of times. She's Director of Physician Affairs for Children's Hospital of Wisconsin. Great to see you again, Doctor.
Nice to be back.
It's unbelievable, though. We're talking about this already. Is their vaccine ready and ready to go?
Right, and many places already have their flu vaccine in stock. If not, it should be in stock by the end of September. And we recommend that everybody not only get the vaccine, but get it as soon as available. We're never quite sure when influenza will enter the community, and occasionally we've seen influenza as early as October. And
for children, now we've gave the general guideline, everyone over 6 months. Are there concerns you have with children within that sort of past that 6 months?
Well, I think what we need to remember is that infants less than 6 months are ones that are most vulnerable for getting really sick from influenza. And right now we don't have a vaccine that can protect them, so we have to rely on other family members being protected so they don't infect those young infants.
You know, I tell you, that's when I started getting the flu shot, honestly, right. When we had kids, and it was like, well, it's no longer just about me. You have to take care of the ones who can't get it.
That's right.
Let's talk about this year's vaccine, because I know last year was kind of a tough year. It was not a good match. Many people ended up getting the flu who got the flu vaccine. How did that happen?
Right. Well, I think, you know, every year they do the CDC and others throughout the whole world look at what strains of influenza are circulating, for instance, in South America right now. And they use that to decide which types of influenza A and influenza B are in the vaccine. It was close last year, but it wasn't a complete match, and so many people still got infected, even though maybe not as seriously if they didn't have the vaccine at all.
I know a lot of people still feel like, boy, if I get the flu shot, I always tend to get sick after. Can the flu shot make people sick?
Well, the flu shot has side effects like most of our vaccines, but it's really just maybe some achiness, maybe a little bit of a fever, and occasionally a sore arm if you get the vaccine as opposed to the nasal spray.
Let's talk about that, yes, as well. For children, I know there was some talk last year that the nasal vaccine might be more effective than getting the shot. I know kids generally like that better.
Right.
Is there, you know, how did that pan out? Is there evidence to suggest that or not?
Right. It didn't necessarily pan out as well as early predictions that were out there. So we don't know that the nasal vaccine is as effective as the shot. And when you're right, certainly kids prefer to have the nasal spray.
Whatever it takes, right? To get
exactly.
them, to get
whatever
them
to get them in there.
And you mentioned supply is already coming in?
Supply is already in, and so just check with your provider if you have questions about which vaccine is best for you, and hopefully that you'll be able to get vaccinated as soon as possible.
Okay, we could use a break. We had a tough season last year, right?
That's right.
All right, well, let's get more people the information they need on this year's flu vaccine and treatment guidelines. The Centers for Disease Control has all of its recommendations online. You can look for a link on our website, TMJ4.com. Here's a quick look.